Two. So, good evening and welcome to Ask Dr. Darwin, a live episode number 2. We are live tonight, being able to talk to you all about your dental concerns, your dental fears, your dental cases that you potentially want to get done as far as dental treatment. But also, this is a live online professional development forum for new dentists also. Okay. So you may see me kind of going back and forth tonight. I've got two mediums that we're recording off of. We got Facebook Live over here, and then over here we have Google Plus and oh man, what's the other one? YouTube over here. So we over here on Facebook Live, we've got a couple people that are on. Hey, Kelly Holman. Dr. Abernathy, hey, what's up? You made it. Yes, I see. You're not at NYU today. Awesome. So, Kelly, what I was saying was type in your comment and your question and send it to me via Gmail. It's newdentistcoach@gmail.com, just in case if it's too much for you to type up here on Facebook Live. Okay, so you can send it to me at newdentistcoach@gmail.com. Again, new dentist. No S at the end. newdentistcoach@gmail.com, and tell me a little bit about your dental situation, guys. Every Thursday night, I come to you live. This is a new show that we're doing called #Ask Dr. Darwin. It's a weekly show for dental consumers and also for new dentists, and it's both like a customer forum. Based on, for you as dental consumers, what things are you concerned about? What treatments are you avoiding? When's the last time you went to the dentist? Why has it been so long? Tooth Fairy's looking for you. I know she's probably looking for you. But if you've had a treatment plan or a plan of action devised for you recently, and you're just kind of maybe just stuck as to what you're going to do, how to do it, if you have some additional questions, this is what this forum is for, all right? For you as a dental consumer, if you have questions about different types of procedures, I'm here to answer those questions that you're going to be asking. But also, it also serves as a forum for my new dentists. My new dentists are those students, whether they're high school and they know they want to be a dentist, or they're in college and they're preparing to apply to dental school. My new dentists are also actual dental students, first year through senior year, that are in dental school, navigating their way through their profession, through their education, and basically are getting ready for the next level, the next plateau of their education, whether it be doing a dental residency to specialize to get some additional training, or it could also be just going into private practice and getting ready to practice the art of dentistry. So this forum is for both groups. All right, it's for both of you. And anytime you have a question, whether it comes up here at Facebook Live, we got a couple of questions that just came up. Kelly, I'm going to answer your question in just a minute. But if you want to, if during the week, if you've got something comes up, or you have an upcoming dentist appointment and you have some questions that maybe the dentist didn't answer, or you're afraid to answer, whatever it is, that's what I'm here for. All right, to help you with your oral health as best as I can and be a resource to you. Okay, so how you do that is by sending me your questions, your comments to newdentistcoach@gmail.com. newdentistcoach@gmail.com. Hey, Monique Johnson, how you doing? Tisha, I saw you, Tisha. How you doing? Good to see you live from Atlanta. Monique, where are you, Monique? I don't even know where you are now. I can't keep up with you. You are Alabama, Florida, Las Vegas, Poonsan. Where you at? Where you at, Monique Johnson? So we have a couple of I have one question and one comment in queue over here at Facebook Live that we're going to read out and kind of help Kelly tonight looks like she will be the topic. Her question and her comments will be the topic of discussion tonight. So, um, but basically, in short, Kelly is like many people when it comes to going to the dentist, meaning many people who have fears of going to the dentist. All right, um, and those fears can be crippling to the point where you're stopped, you're frozen. You're not going to go. You're not going to make that phone call. You may have a tooth pain or a chipped tooth or a broken tooth, but because of that fear is so immobilizing that you don't go. You don't go. So basically, tonight, one of Kelly's comments is the following. So, Dr. Hayes, Dr. Darwin, I have a chipped tooth with a metal filling that is very exposed. All right. It chipped back in 2012. No pain, but I know there are dangers waiting if I do not fix it. My fear and tears stop me. So she also inboxed me some additional information, but pretty much it sounds like it's more of a dental fear as relates to what I just said. Crippling and not allowing you to get the treatment done. So one of the things that one of the ways to overcome that fear is really just identifying what exactly is the fear. What are you fearful of? Are you fearful of the anesthesia? Are you fearful of maybe your tooth falling out? Maybe I've had some people that I know that call me the next day. They've had a bad dream and they're like, "Yo, doc, I had this weird dream and I was on a plane. I was going somewhere and then all of a sudden my teeth started falling out. What does that mean?" Like I'm some psychic too. What does that mean? My teeth are falling out. My teeth were falling out in a dream. And I say, man, I don't know. I have no idea. But that's how deep-seated those fears can be sometimes. They're so deep that, your mind starts playing tricks on you and you start thinking about them in your dreams. So bad. So it can be immobilizing. Almost to the point where, like Kelly says, the fears stop her. They prevent her from going out and getting the treatment done. So one of the things, Kelly, a couple things here. We got some responses. Dr. Abernathy has come on to the chat and mentioned a couple things that we're going to talk about. But one of the things is, right, sometimes fear is immobilizing, but also sometimes fear is a motivator. One of the things that motivates a lot of people, especially if they're in the public eye or they talk in front of people, whether it be job or social or civic, is that this smile here, people don't want to have a jacked up smile or a tooth that's crooked or a tooth that's overlapped or a tooth that's discolored or even a tooth that's chipped, right? Because there's a level of not having a lot of self-confidence with something in this smile zone. I call this the smile zone. Even though you see these teeth in the front here, people also see them from the side because you don't always talk to people face to face. Sometimes they see you from this side or they see you from that side. So it's everything. It's not just these front teeth, but these teeth on the side too. All right. So any time there is what we call a misaligned or malaligned smile, if it's in the front, usually in the center, in that area, this is the area that people are naturally going to draw their eye to. Right here in this area. Boom. All right. There's a balance. If we were to draw an imaginary line down in between your eyes, between your nose, down through your lip, there's what we call a midline. And using that midline, what you see on the left should be the same thing you see on the right, meaning there's balance. And with that balance and proportion, there's beauty that's built into the appearance of that area. So anytime let me take my ring off here. Anytime there's imbalance, meaning one tooth longer than the other, right? Or one tooth rotated in comparison to the other side, right? What's going to happen is your eyes or someone else's eye is going to be drawn right to it. Hey, Leisha, how you doing? Good to see you. Good to see you. Your eye is going to be drawn right to it, and boom. That's where a lot of people have problems with their confidence, or they just don't feel like they want to smile. You know, some kids do it too. You ever notice your child or your nephew or your niece when they're in between their baby teeth and their big boy or big girl teeth? They get, it's called, what we call in dentistry is called the ugly duckling stage, where the baby teeth start falling out and they're missing the teeth and all you see is gums. Well, I know some kids that when they go to a birthday party and they're asked to smile, they smile like this. Or even if there's kids that have some of their teeth and they have both their baby teeth and their big boy teeth or big girl teeth, but they're misaligned, or one's crooked, or one's overlapped, or one's to the side. Still, when you ask them to smile, this is what they do. Because they're self-confident. Self-conscious about their teeth, and they don't like the way they look. Well, they don't like the way they look because they're not balanced. All right? One side's leaning over or one side's missing. They're not balanced. So look, even kids notice it too. All right? So anytime there's any type of misbalance or imbalance in the front, if you can see it, other people probably see it too. So that is a motivation for a lot of people to get that balance restored or get it fixed. For you, Kelly, that tooth is chipped, so that's one thing that you're concerned about. The second thing is, you said that there's a metal filling that's there, and if it's metal, it's probably gray, which is not natural looking on your tooth, right? So you got two things that you're dealing with on top of the major thing, which is your fear of not going to the dentist. What's up, Shelton Quarles? What's up, cuz? Much love to you. How you doing? So we're talking about Kelly, who had a question about being fearful of going to the dentist. She's got a chipped tooth in the front. It's rotated, crooked, and then also it's discolored. It's got an old metal filling, but her fear is she can't go to the dentist because she's fearful, but she knows if she doesn't do something quick, more can happen. And you're right, Kelly. You should be concerned about that, because it's like this. It only takes one bite of you biting into, an apple, or you biting into chewing something. It only takes one instance to have additional trauma to that tooth, where that tooth can break some more. It could chip some more. All right. It only takes one cycle, one bite down, and then you're really going to be probably more concerned. Not trying to scare you, but also that's a reality, right? That's a reality. So one of the things that we asked Kelly was, well, if you're fearful of the dentist, what are you exactly fearful of? All right. And one of the things that Dr. Abernathy, Angela, asked Kelly was, are you open to sedation dentistry? Have you tried anything like Valium? Valium is an oral sedative that's used. Some people use it when they're flying and they're just so antsy about flying, but we also use it as one of the oral sedatives in dentistry. So she said that she has, I'm not sure what Kelly, looks like Kelly said yes, that she is open to sedation, but I'm not sure if that yes is to the second part of that question, which is, have you ever tried anything like Valium? So the main thing that Kelly is fearful of, she says here, is pain, right? Pain. And then the other thing she's fearful of or doesn't like is hard hands. I think I know what she means. Hard, heavy hands, not gentle, not soft, not caring, more rough around your mouth, around your face. I mean, you got to remember, guys, in this area here, in your head, any nerve endings or any nerves that are in this area are much more sensitive here than they probably are in other parts of your body, primarily because they're much closer to your brain and to your spinal cord and everything else. So, yeah, you can, if you run into a dentist that has some heavy hands, some rough hands, you don't want additional sensitivity from that. So that's that. So basically, in Kelly's experience, she had an extraction and on the bottom, and here it is. This is why we got to get to the source of the fear. She had an extraction on the bottom, and her lip never regained its feeling again. So it sounds like, Kelly, like you had a traumatic experience to the point where the nerve ending or where the tooth was located was traumatized, and those nerves will also supply some feeling to your lip or your lower chin here in that area. So now what happens to Kelly, which happens to many people, is you say the word dentist, and it's like this. Or you say the word extraction, and it's like that. Or you say the word anything that deals with the mouth and someone fixing or helping. Kelly's probably like, nah, I'm good. I'm good, B. I'm not doing that. I'm not doing that because she's reminded of that traumatic experience. So one solution could be the actual. I'm just reading her comments here. One solution could be the oral sedation. All right, the oral sedation. And Kelly said, she said one of the solutions that most dentists will go to when they're treating her is to get her sedated. She said, but usually, literally, she cries and breaks down, and it usually takes about 2 or 3 pills, which can take several hours to take. It takes 2 or 3 pills for her to actually feel calm and comfortable to the point where she's probably like this and just kind of conscious, but out of it, but just more relaxed and less apprehensive. And for some people, guys, hey, that's what works. That's what works. What's so nice these days about modern dentistry is that you don't have to worry about some of the things that were done in the past as relates to old time dentistry. With oral sedation and even with the pills, or even if you want to be knocked out as far as a little bit heavier sedated. One of the things we do now in dentistry in some offices that we'll hire anesthesiologists, a dental anesthesiologist, and we have him or her come to the office and they do just that. They will put you to sleep. You'll still be conscious, but you won't be coherent, so to speak, okay? And for a lot of people, that works. That sedation allows the dentist and allows you to get to maximize your time and decrease your fears and get that work that you need to get done. And yes, Kelly, you're right. Someone probably told you right, and this is true, which is if you don't get that chipped tooth with that metal area that is exposed, if you don't get that handle, over the course of time, yeah, you could have a funky smell that comes from it, okay? Some of that funky smell is could be because of bacteria that's lurking in and around that tooth, around that chip, and around that metal filling. Another reason why you must go to get it checked up, all right? Rather you get it checked out and find out that it's just, something that can be replaced versus you don't and you wait and you find out you have more, you start to have that pain that you're not having now. You start having pain and it could be worse. Because if the bacteria continues to grow or go deeper into the tooth, it may hit the nerve of the tooth. And then you're really going to be like, oh man, why didn't I handle this a long time ago? So again, sometimes pain is a motivator, but the perception of pain and the promise of pain should also be a turning point for you to go and get it checked out. Okay. So, I'm trying to see. I got another question here. Shelton, I'm gonna get to your comment. I think that'll be probably the last one for tonight. So Shelton, I'll get to you about implants in just a minute. So Kelly, so you got that. Hopefully that's been helpful. Looks like a little bit more information about Kelly's case is she had an extraction that was impacted, and she had the tooth taken out. And lots of times when teeth are impacted, or meaning they haven't come all the way through the gum, they're impacted, okay? They haven't grown all the way through the gum. So what happens sometimes is that they're a little bit more difficult to get out. Usually we, in my office, in my practice, we usually send people out to the oral surgeon, oral maxillofacial surgeon, and they'll do a lot of third molar extractions, and also those impactions that are symptomatic or causing you problems, okay? Also, keep in mind, with third molar or your wisdom teeth extraction, my philosophy is this: if it ain't bothering you, we're not gonna bother them. 1, 2, 3, 4. Usually everyone has about 4, anywhere from 2 to 4 wisdom teeth. All right, we call them wisdom teeth because you get them much older, and usually in your life. Usually around, they start coming in. It could be as early as 17, 18, but for some people it could be a little bit later in their 20s. But if they're not bothering you, they're not causing any problems, you can sleep at night, you can eat. My philosophy is, they're not bothering you, not bothering me, I'm not going to bother them. All right? I'm not going to send you to the oral surgeon to get them out. That's just my philosophy, okay? Now, if they're symptomatic and you're having some problems in chewing, or, on subsequent visits, you're having some swelling due to them trying to come in, then, we're talking a little bit something different we need to check out, okay? So hopefully that's helped, Kelly, about your fears. Tony Johnson, Dr. Johnson, what's up, man? What's going on, brother? We got a pediatric dentist, one of the top pediatric dentists in the DMV. That's DC, Maryland, and Virginia, for those of you that are not from that area, the DMV. Tony Johnson is got a practice in Bowie, Maryland, pediatric dentist. So if you got some kids, guess what? Dr. Johnson, he loved the kids. So you can Google him, Anthony Johnson, Anthony G. Johnson. Google him, Bowie, Maryland. I think he's got a couple other offices, a couple other places too in Maryland too. So Kelly, you're welcome. Hopefully that helps you. Her last part of her question, and then we're going to move on to the next one before we run out of time tonight. Her next part of the question is, how do you pick one? Meaning, how do you pick a dentist? How do you pick one that will tolerate me as a patient? That would tolerate you as a patient. Kelly, it's almost like picking, I don't know. It's almost like picking your mate. How did you pick your husband? I'm pretty sure y'all went on a couple of dates. Y'all talked. You got to know each other. You communicated, right? So it's the same thing. It's the same thing when you pick your dentist. It's the same concept when you pick your church. It's the same concept when you pick a school for your kid. You've got to get in communication with those that are providing the service. Same thing here. You got to get in communication with your dentist. You got to find someone that can manage your fears. And how do you do that? You just gotta go out there and start to look for them. All right. Lots of times there's some dentists that are out here that promote that they do sedation dentistry, what we call sedation dentistry. We have some other dentists that are out here that promote that they do sedation dentistry where they put you to sleep. It's getting good here when I start taking off my bow tie, y'all. So one of the things that you can do, Kelly, is start to Google like sedation dentistry or dentistry and fear. And in your area, put in your zip code, and you'll be able to find somebody. I mean, that's how you'll start your list. That's how you start your list to find out who you're going to go and who you're going to interview. You're going to interview. That's what I would do. Just like you would interview your OBGYN, or, if you got a referral from somebody, that's helpful. But at the same time, at the end of the day, you want to make sure that they, or he or she, or that office is able to cater to your needs. Well, how do you know that? You don't know until you go in and you meet them. You talk to them. You maybe go in and do a consultation with them. You know, a lot of offices will have a complimentary consultation, or even if it's a paid consultation, it'll be worth the money. All right, to find, because your end goal is to find someone that can help you with your fear and get your smile back to the way that you want it, that you need it, that you deserve. Okay, so hopefully that helps with regards to that. And see, another question I have, Shelton Quarles, what's up, cuz? What's going on? So Shelton's question deals with implants. I need a couple of implants. Realistically, what are the major concerns with getting them? So again, Shelton's question is, I need some implants. I need a couple of implants. Realistically, what are the major concerns in getting implants? So a couple of things come to mind immediately, Shelton, which is, first of all, you have to have a little bit of some working knowledge of how implants work. Implants work very similar to how your tooth is already in your bone or in your jawbone. Okay, your tooth is supported by bone. All right. Just like the bone that runs all throughout your body, that your skin and your organs kind of wrap around and stuff. It's the same thing here. You can't see your bone, but you can definitely feel it, right? You feel the side of your face here, up here, all this around this maxillary or upper area. This is all part of your skull and your skull bone, and this is all part of your jawbone. So just like teeth, implants are situated within bone, okay? So one major concern about getting implants is you got to have bone. You got to have enough bone so that the implant can be placed in that area. Now, it probably sounds a little, gross, and I know it's a Halloween time and everything, gory and bloody and all that stuff, but really, it's easier for us as clinicians to place an implant than it is many times to do an extraction. It's easier for us to place an implant or restore an implant or fix an implant than it is for us to take a tooth out. All right. Again, modern technology, how we're able to work with the materials and the equipment that we have and everything that we've learned about the oral cavity and all the structures there allow us to do that with a much higher efficiency and accuracy than we've done over the last 20 or 30 years. So to continue answering Shelton's question, one of the major concerns about implants is bone. You have to have enough bone in the area for the implant to take. So here's my finger, right? Finger is the implant. My cup here is where the implant goes. Boom, goes right into the socket, or where there's not a tooth there. But in order for that implant to retain, you've got to have enough bone to retain it or hold it in place. All right. So this is the bone level. Now, this is my hand. This is the bone level. If there's not a lot of bone, or the bone starts to get melted away, or there's not enough bone, you see what happens to the implant? This is the bottom of the implant. You see what happens immediately to the implant? There's no bone. Now it's going to start to move, and it's going to fall out. You guys didn't see that over here. Again, hand, bone, implant goes in, and my other hand here is squeezing as I'm squeezing. That's the foundation. That's the bone. But if the bone level is not up, but it's down like this, guess what happens to the implant? You start to see the bottom of the implant now, right? Again, if the bone is not at a thick enough level, or if it's not a lot of mass in the bone, that implant's not going to take. It can get loose, it can fall out, and boom, you're back at square one. I don't have a tooth there anymore, doc. So one of the major concerns about implants is you've got to have enough bone. And one of the things that will happen when you go to your dentist, or a dentist that places implants, or a surgeon, or even a gum surgeon, a periodontist, or even a prosthodontist. That's a dentist that has special training in doing implants, crown and bridge, dentures, and things like that. one of the things that we do now in modern dentistry is this is new technology where we're able to not only see all the bones in this area, this oral cavity, pertaining to where implants can be placed, but also we can take digitally, we can take small little sections, take pictures of small little sections of your jaw to see exactly how much bone is in this area versus this area versus this area, and what the thickness is from front to back. So front to back. So all the thicknesses we can measure all through this one type of digital radiograph that goes all the way around your face, and it's a 3D image, which has now revolutionized the placement of implants, and now we know exactly where to place them into the bone. It's called guided implant surgery or guided surgery. All right. So if you're looking into getting some implants due to some missing teeth, you want to make sure that your dentist or whoever he or she is referring you to does one of those, what we call 3D digital scanning of your upper jaw and your lower jaw to see how much bone or thickness of bone that you have, to see if they can place an implant there. Now, it's one thing to place the implant there, but there's the second part, which is restoring the implant. Once the implant is placed in the bone and it's healed, usually for 3 to 4 months, now we got to put a tooth or a crown or a top of the tooth on that implant. Again, that implant is going to serve as like the root of your tooth, of your missing tooth that had to be extracted at some point. So the second part is putting a cap or a crown on top of that, on that implant, a crown on top of that implant. All right. So that's the second part. So that's the second concern. You want to make sure that wherever they place the implant, that it can actually be fixed or restored or put into function. Because you don't want to have an implant over here, but when you bite down, it's not in the same area where you're biting down, and now you got an implant somewhere that can't be utilized because you can't chew on it. So that's the thing. You want to make sure that where they're placing the implant is in the area where you need it, so that you can bite down, chew, function, and get your eat on. All right. So those are the two issues with regards to implants. So guys, I'm looking at my time here, and we're going a little bit over tonight. So this has been episode 2. Thanks so much for joining tonight. This is Dr. Darwin, and this has been Ask Dr. Darwin, our weekly show. Aaron Rice, what's up, brother? What's going on? What's up with the bros? So we're going to close out for tonight. Listen, within the next 6 to 7 days, if you have something that comes up, you have a question about your dental care, your dental oral health care, give me a shout out. Give me an opportunity to help you, to share some information that I have based on my nearly 20 years of experience as a dentist. Send those questions that you have to newdentistcoach at gmail.com. Again, that's newdentistcoach, no S at the end of dentist, newdentistcoach at gmail.com. Type in your question that you have about your dental care, your oral care, and at the end of it, put in hashtag Ask Dr. Darwin. Hashtag Ask Dr. Darwin. That way, that ensures that we get your question asked first here, and then we can answer it on the live show. All right. Again, I hope this has been helpful tonight. Thank you, Kelly and Shelton, for those questions about dental fear and also about implants. And also thanks to Dr. Abernathy for also contributing to Kelly's question about fear and sedation dentistry and how that could be helpful for you. Guys, again, please, I need your help. Please share this forum every Thursday. Share it with your friends, your family members, people that you care about, people that you know that have been talking about maybe teeth whitening or a smile makeover or something similar to that. But also let your colleagues know if you're a new dentist and you want have some colleagues that have some questions about life after dental school, or how to get into dental school. What am I going to do? How am I going to pick a residency? Where am I going to work and live? All those questions for both dental consumers and also for new dentists. We can answer those questions here, but also check out I want you guys to subscribe to my YouTube page, my YouTube channel. It's called Dr. Darwin Speaks. Right now we're on trying to hit our goal of 1,000 subscribers on YouTube. That way, you guys are helping me so that I can help you and other people about oral health and about professional development for new dentists. If you haven't already, go on to YouTube, Smile Dr. Darwin, and I'm sorry, not Smile Dr. Darwin. Go on to YouTube. The page is, I haven't had enough of this coffee today. This is like my third cup. This is the Lucifer of coffee right here. All right, daggone Starbucks. I just gave them free promo. But go on to YouTube, and it's called my channel is called Dr. Darwin Speaks. Dr. Darwin Speaks. Subscribe. Hit the subscribe button. Share it with other people. I got a whole bunch of different videos, especially for new dentists, about some tips, some strategies that I think will be really, really beneficial as you continue in your profession, in this profession, and continue throughout your careers. Share it with people. Our goal is to get 1,000 subscribers by the end of the year. So by December 1st, I want to see what our number is. So if we have to make another push, we can do that. But please, help me help you. Tell people about us. Send your questions. And share this and other things on your Facebook page with your Facebook friends. Share this live video. Post it on your Facebook. Post it in any groups that you belong to, and then also just share it with your colleagues at work, in your church, in your fraternity, in your sorority, whatever it is. My goal is to help as many new dentists and patients as possible, and this is one of the things that I've created to try to add some value to doing that and helping you. So help me, help you, and help others by sharing this information, sharing where I'm located, and checking out and subscribing to my YouTube page, okay? Hey, this is Dr. Darwin Hayes, new dentist coach. This has been our second episode of Ask Dr. Darwin. Thanks so much for joining us. God willing, we'll see you next week. Keep those questions coming. newdentistcoach@gmail.com. Also follow me on Twitter, Smile Dr. Darwin, and also Instagram, Smile Dr. Darwin. Okay? Thanks, guys. Much love to you. Have a great rest of the week, and have a great weekend coming up. Thank you. Take care. Good night.